Hello everyone. Today I would like to discuss with you regarding high blood pressure or hypertension. Uh, the definition of hypertension or high blood pressure is two readings of more than 140 mmHg, that is the top number, 140 mmHg, and the lower number more than 90. And basically our blood vessels, हमारी जो blood vessels होती हैं, they contract and dilate depending upon the tone. There's a tone that everybody has maintained in the body, and the depending on this tone from this vagus nerve, our blood pressure can go up or down. Now, most people are genetically predispositioned to have hypertension, but there are other factors that actually make the patient more predisposition to get diabetes, such as high sensitivity to salt, comorbid conditions such as obesity or diabetes. Now, what is the benefit of treating hypertension? Why do we make this such a big deal? हाइपरटेंशन इतना बड़ा डील क्यों है? इसका रीज़न ये है कि हाई ब्लड प्रेशर जो है, every organ in the सारे organs in the body require a blood supply, and if the blood supply is very high, it can cause damage to the end organs. So it can practically affect every organ in the body, or that is why this is called a silent killer. Now, if this high blood pressure affects the brain, it causes a stroke. If the high blood pressure affects the blood vessels in the heart, it causes heart failure. And if it vice versa, agar ye high blood pressure, if it happens in the kidney, then it causes kidney damage and kidney failure. Now, research has shown that if you continue to get this treated, your high blood pressure treated, even by 5 mmHg, the risk of stroke goes down by 34%. The risk of ischemic cardiomyopathy or heart disease goes down between 21 to 28%. Now, the treatment about high blood pressure is very simple. Number one, best treatment in the world, lifestyle. इसका मतलब ये कि we have to cut down our salt intake, and secondly, continue with exercise. Now, most people say a little bit of walking, 30 to 40 minutes a day is sufficient. Actually, that is not the case. The research shows that the exercise should be 30 45 minutes up to 4 days a week, but this exercise should make you sweat. So if you're brisk walking or walking slowly, even for 45 minutes, that's not going to be helpful. Secondly, the diet, like I explained, there should be low salt. Things like like soups and anything that might contain a lot of salt, they should be cut down. Things like soda is very bad for health. And then secondly, if that does not get it controlled, it's really important to have this blood pressure control, and then we go towards medications. Now, why I prefer lifestyle is the way to go is because medications have side effects, and the main medication, the first one that we start, is just called chlorthalidone. It makes you urinate, and that lowers the blood pressure. But while urinating, you also lose electrolytes such as potassium that actually regulate the body. So, in summary, basically, blood pressure is a silent killer, or one should maintain a blood pressure less than 140, ideally in the 120 range. And if your blood pressure has been fluctuating high, you should definitely keep an eye on it daily, and try to practice lifestyle. That's the most important. Try to lose weight, and that will lead to a better, healthier lifestyle, and it'll actually expand your life by preventing diseases that might reduce your lifespan as well as make you it could make you disabled. If there's any questions, please add them to the comment section.